Hello, everybody. My name is Moises Rendon. I'm the director of the Future of Venezuela Initiative and Fellow of the Americas program. I would like to also welcome those watching online. Just for the record, this event is being recorded and will be available after the event finishes. Today, we're discussing why the Venezuelan crisis needs to have a global response, right? Especially if you compare Venezuela to other countries in crises like Syria, South Sudan, Myanmar. Venezuela receives significantly less humanitarian aid. It's yet to be a significant donor priority despite levels of displacement that rival Syria's. For example, 15% of the Venezuelan population has already fled the country. Or also the disease and hunger levels that we see in Venezuela are rivaling sub-Saharan African countries' conditions. So in a way, this is an important humanitarian gap that we see, and this is why we're bringing this discussion into the policy community in Washington and the international community. First, we will hear from David Smolansky. He's the OEA Secretary General Special Envoy for Venezuelan Migration and Refugee Crisis. He's a former mayor of El Hatillo in Caracas, in exile now. Most of you know David Smolansky. He's a scholar at Georgetown University, was removed from office by the Maduro regime, disqualified from any public administration role, and has a warrant out for his arrest. He was elected as the youngest mayor in Venezuela, founding member and deputy secretary general of Voluntad Popular, one of the main opposition political parties in Venezuela. He has received multiple awards by international organizations and universities. Perhaps more importantly, he's a UCAVista. For those who you don't know, he's coming from the best university in Venezuela. I'm not saying that because I'm also UCAVista, but he's a journalist from Universidad Católica Andrés Bello in Caracas and has a master's degree from Universidad Simón Bolívar in Caracas as well. After David speaks, he's going to provide a 15-minute PowerPoint presentation for you all. After he speaks, we're going to have a thoughtful expert panel conversation about why this crisis matters, not from a Venezuelan, not from a regional perspective, but from a global perspective. Why we need the international community more involved on the Venezuelan humanitarian crisis. And for that, we're going to have 3 excellent top scholars from CSIS. Which, by the way, I'm glad to report that CSIS just yesterday was found to be ranked the #1 think tank in the United States by the UPenn think tank ranking 2019, and that's why. I mean, the reason why is scholars like the ones that we're going to hear today is because of their work, right, and their research that we're now on top of the country right now. So thank you for all of your work on that. But just briefly, we're going to hear from Errol J. Book. He's the Deputy Director and Senior Fellow of the Project on Prosperity and Development and the Project on U.S. Leadership and in Development. Errol is a thoughtful thinker on U.S. foreign assistance, migration, forced displacement, conflict-aware stabilization. He's the author of multiple migration reports that I encourage you all to read. He's been in more than 10 countries around the globe to study the forced displacement that we're seeing in other countries. And he's going to bring to the table his perspective of how this refugee crisis in Venezuela is affecting the region from his high-level point of view. We're also going to have Jacob Kurtzer. He's the Director and Senior Fellow of the Humanitarian Agenda, which is an initiative that leverages the expertise of CSIS programs to explore complex humanitarian challenges. Jacob's focus is the Task Force on Humanitarian Access, which looks at the challenges in access to aid in complex man-made emergencies, which is very relevant to what we're going to discuss today. Venezuela is a man-made emergency, and one of the big challenges that we have is access to aid, right? The Maduro regime is still rejecting humanitarian aid from the international community, so I look forward to hear Jake's, and thank you for being here on this panel. And lastly, but not least, we'll have Catherine Bliss. She's the Senior Fellow at the Global Health Policy Center at CSIS. She's a top expert on issues such as global health challenges like HIVs, vaccine preventable diseases, access to drinking and drinking water and sanitation. And she has a previous life in the Americas program. She was the deputy of the CSIS Americas program, and she has also been a great ally on Venezuela health-related issues on our program. So I'm thankful for Catherine to be on this panel as well. Okay, with these introductions, let's kick off the event with David. Thank you, David. The floor is yours. Presentation.
Okay, just sorry. So, good morning, and thank you so much for CSIS for inviting me. Thank you, Moises, for your kind words. It's a real honor to be here and to talk, which, in our opinion, it is the biggest and most devastating migration and refugee crisis in recent times in Latin America and the Caribbean. I have been working as a special envoy of Secretary General Luis Almagro from at the end of 2018. We have visited the region 16 times. Just last year we went to Colombia 6 times. We went to Peru, to Ecuador, to Brazil, Costa Rica, Curacao, Aruba, Mexico, and also different cities here in the US and Canada where there is Venezuela diaspora. I am, as Moises said, Venezuelan. I've been living in exile for more than 2 years. I started my political career as a public servant when I was a student leader, and I have been able not only to be a mayor in a town in Caracas, but also to know a lot my country. And I could tell you that I have never ever seen anything like what I have seen in the border, the testimonies, the suffering of the people, and the desperation of Venezuelans fleeing to find opportunities in other parts. So I'll give you a background, because this crisis needs to be interpreted not as a regional problem. It has to be interpreted as a global crisis. So hopefully this will be very useful to you, and I'm going to end with the challenges that the region has, in our opinion, for 2020. So as I said, the current regional crisis of Venezuelan migrants and refugees is unprecedented in the region. 5 million people have fled Venezuela since the end of 2014. Actually, it's not over 14% of the population, already it's over 16% of the Venezuelan population is gone. This is the latest numbers that we have. Obviously, this is literally changing week by week. You could see Colombia is the country with more Venezuelan migrants and refugees, 1.6 million. But then we have Peru with 900,000, Chile and Ecuador with 400,000, Brazil with 230,000, Argentina 150,000. So that's what we call the G6, between Colombia, Ecuador, Peru, Chile, Argentina, and Colombia. There is more than 75, almost 80% actually, of the Venezuelan migrants and refugees. But also you could see more than 420,000 Venezuelans already in the United States. And there are other countries like Spain where you have more than 330,000 Venezuelans. And also I want to point out the Caribbean. When you see Guyana, Trinidad and Tobago, Curacao, Aruba, and Dominican Republic, we're talking that at least 100,000 Venezuelan migrants and refugees are in the Caribbean. And on the case of Aruba and Curacao, I always say this, 15% of the population of those islands are already Venezuelans. So on relative number are the highest in the region. On absolute numbers, of course, Colombia is the first one, and then Peru. But we have also to interpret that on relative number. And on relative number, Aruba and Curaçao, which are part of the Kingdom of the Netherlands, so border with the European Union, have the highest number of Venezuelan migrants and refugees on relative numbers. So globally, only Syria, that have been in a war for 9 years, have more refugees than Venezuelans. But let's put it another way. Venezuelans right now are the largest displaced population of the world with no natural catastrophe and no conventional war. And that's going on in our hemisphere, in the Western Hemisphere. So you could see which are the largest migration and refugee crises in the world. Syria, Venezuela is in second, Afghanistan, South Sudan, and Myanmar. When you see all the other countries, all of them have some in common. They have been through a war, they have been through armed conflict. It's not the case in Venezuela, at least it's not in a conventional way. So the number of Venezuelans, migrants and refugees, it's greater than the population of 70 countries in the world. And I want to give you an example of the dimension of this crisis. Look at this. This is the whole population of Croatia, Kuwait, Ireland, New Zealand, and Costa Rica. Venezuelans abroad as migrants and refugees are more than the population of those countries. Countries in the region, that's like Costa Rica, countries in Europe like Ireland or Croatia, countries like Kuwait, the Middle East. And there are other countries, for example, there are more Venezuelans than Panama, the whole population of Panama, or the whole population of Uruguay, or the whole population of Qatar. So this is something that we have never seen. And I have to say that Venezuela used to be a country that received so many migrants and refugees. It is said that by the 1970s, approximately 4 million people from other countries were living in Venezuela, specifically from Europe and from Latin America. Now, more than that number have fled the country. Also, the walkers. The walkers are walking approximately 4,000 kilometers. What does that mean? The people are fleeing Venezuela is in a very vulnerable situation. They are fleeing from very popular areas, shanty towns, rural areas. So the people are not fleeing by plane, or not even some of them are leaving by bus. They just walk. They just wake up one day and they decide to walk. So they're walking from Cucuta to Lima, let's say, is more than 3,500 kilometers. To put that in perspective, that is the same if we start walking right now from here or New York to Salt Lake City, approximately. How desperate has to be a human being to walk from Washington to Utah to find a place to eat, to find a hospital for medicine, to find a place to sleep, or to find just a town to live safe? How desperate has to be someone to walk that distance from, literally in this country, from the East Coast to almost the West Coast? That is the desperation that Venezuelans are having because of the regime that we have. You see in Europe, it's like you walk from Spain to Finland. Those are the distances that Venezuelans are walking. So, in average, 5,000 Venezuelans are fleeing daily. That is the same to say that 200 Venezuelans are fleeing every hour. So just to give you a perspective, when this conference ends, more than 200 Venezuelans would have fled the country. That's how critical is the situation right now. So on these visits that we have made, we, of course, our priority is to meet with the refugees, to have with them roundtables. We also have meetings with NGOs, foundations, and different organizations are working on the field, and of course we meet with the governments. And we have found the 5 main determinants that people flee. And this is probably for Venezuelans and some people that have followed this crisis something basic, but not everyone knows. And the challenge is to explain how 5 million people have fled when you don't have an earthquake, when you don't have a hurricane, or when you don't have a civil war or conventional war. So the humanitarian crisis, of course, is probably the main one. According to the United Nations, at least 7 million Venezuelans are in need of humanitarian assistance. So when you don't have, when you cannot have breakfast, or when you go to sleep and you didn't have dinner, you just literally start fleeing the country. Not only to feed yourself, but especially the ones who have children, to feed their children. The economic collapse, Venezuela is going to a hyperinflation, is de facto now is using dollars or euros, so even though the ones who have a job, hyperinflation is impossible to keep that, and Bolivar is worthless at the moment. Third, human rights violations. Since 2014, at least 15,000 people have been illegally detained. And I'm not counting there the hundreds of repressions, persecutions, threats that Venezuelans suffer, specifically on the testimonies that we have heard. The young people, students, they were victims of repression during protests that we had in 2017, 2016, 2014. They were illegally detained for days or weeks. So after they were released, the decision that they took is to flee. They were even threatened in their houses by irregular groups such as colectivos. The lack of services, this is something important, specifically since March of last year. March 7 of 2019 is on the top of mind of almost every Venezuelan. 70% of the territory went completely dark for more than a week. So the fear to leave that again just caused that so many people fled Venezuela. And of course, it is very common to see on different cities and towns in Venezuela every day lack of electricity. You see so many towns that for 4 hours, 8 hours, even the whole day, they don't have electricity or they don't have water. The other one, which when I was a mayor, that was my priority, and I think is the biggest challenge that we have in Venezuela, the general violence. Venezuela is one of the most violent countries in the world. Actually, Caracas is the most dangerous capital in the world. Just last year, 16,000 Venezuelans were killed because of crime. And since 1999, almost 350,000 Venezuelans have been killed because of crime. That's 7 times Yankee Stadium. So 7 Yankee Stadium, full capacity, have been killed in Venezuela since 1999. So basically, when you live in a place that you are not safe because you can get killed or you can get kidnapped, you just flee. And the first migration flow that happened in Venezuela, that was actually before the humanitarian crisis, the vast majority went to Miami and went to Spain, was because they were victims of crime. So there's no solution in Venezuela. We're going to see, unfortunately, and highly probably this year, more Venezuelan refugees than Syrian refugees. This is a graphic that we worked on our report that we presented last year, that we worked with different experts. One of them is Danny Barr, who is a fellow Brookings Institute, and you can see the projections and how these crises have been behaving since started. You could see the red line is Venezuela, and it's almost the same as Syria during the first 4 years. And the projections that we're doing. So this is just a basic calculation here. If 5,000 people flee every day, that's 150,000 people monthly. If you go 12 months, that's 1.8 million. So in a very conservative estimation, projection, if we are now in 5 million and 1.8 million flees, this year we're going to have at least 6.8 million. But of course, that's not the only projections you have. You have things that happen in the country that if it gets worse, more people are going to flee. Also, this is one of the most underfunded refugee crisis in the world. Per capita, for example, a Syrian refugee is $5,000 and the Venezuelan refugee is $100. You can see the total. Of course, these are estimations, how the international community has provided donations to Syria, South Sudan, Myanmar, and you see Venezuela. So remember one of the first slides that I showed, we are the second largest refugee population in the world, but it's a very underfunded crisis. And you can see here also a graphic that we have worked. So, which are the challenges on the minutes that I have? Which are the challenges that we have in 2020 in the region with this crisis? First of all, approximately 2.5 million out of the 5 million people that have fled Venezuela don't have documentation, or the documentation that they have is about to expire. So the region needs to work quickly on a consensus to have a documentation, an ID that allows Venezuela to be regular, and if they are regular, they could apply for a job, they could open a bank account, and the young people could have access or education, and of course everyone healthcare. Second, healthcare is a big issue here. Just to give you an example, so I could be talking here for hours on healthcare, 80% of the women that are giving birth in Cucuta are Venezuelans. And 70% of the women that are giving birth in Boavista, which is the border with Venezuela in Brazil, are also Venezuelans. And approximately 1.5 million of the people that have fled Venezuela are suffering from malnutrition or are in risk to be in malnutrition. So that's another challenge we have. And the third, but not least, is on security. Specifically when you don't have the people with their documentations, we're seeing things, especially in the border with Colombia, that Venezuelans, specifically teenagers, are being recruited by regular groups such as the ELN and are getting unfortunately involved in illicit activities such as smuggling or drug trafficking. But that's also happening at the border with Brazil, at Bolivar's state, where is the arch minery, where also part of that mines are controlled by irregular groups, and those irregular groups are recruiting Venezuelans. So those are the challenges that we are seeing for 2020. Our main proposal is that the Cartagena Declaration should be applied for Venezuelans. Venezuelans should be formally treated as refugees. And the Cartagena Declaration is the only resolution that expands the concept of refugee and says that a refugee is someone that flees a country because of general violence, human rights violation, alteration of the public order, and foreign occupation, by the way, which could be discussed right now in Venezuela, especially when Maduro a few days ago recognized that there are 23,000 Cubans in Venezuela. So the refugee status for Venezuelans is something that should be agreed on the region. Brazil already is implementing it. Mexico is already implementing it. I always put the example of those two countries that have a different approach on the Venezuelan crisis, but are sharing the same policy for the Venezuelans who are arriving to those countries. And Venezuelans need protection, and it's not only the best solution for them. I am convinced it's the best solution for the receiving countries, because they will be benefited with people that want to entrepreneur, that want to work, that want to study, and in the future, Venezuela will need the migrants and refugees to go back and to be part of the rebuilding of the country. Venezuela is a different country right now. It is a different country of last year or 5 years ago. So to think that Venezuela will rebuild after we restore democracy and freedom with not taking the migrants and refugees, that will be very naive. That will be a huge mistake. We have to start thinking on the policies that will encourage the ones who have fled to go back to the country, or at least if they decide to not go back, to keep them engaged. And the biggest challenge, and with this I'm going to end, the biggest challenge is to restore democracy and freedom in Venezuela. There's no other solution. If we do not restore democracy and freedom in Venezuela, as I said before, we're going to see more Venezuelan refugees than Syrian refugees. So if we want to stop people fleeing the country and suffering, the best solution is to restore democracy and freedom. That will not only permit people to stay in Venezuela, but also encourage the ones who have fled to go back. Because when you are forced to flee, like what happened to me, that I had to be hiding for 35 days, go through a jungle, you can, after the hard work, you can recover some things. But what you cannot recover is the separation of your family. And the thing that is suffering most Venezuela right now is to be away from their families. So that's the biggest challenge that we have in 2020, and hopefully the international community will be more aggressive on that. Thank you so much.
Thank you, David. That was a thoughtful presentation. I think it was very helpful to frame the conversation that we're gonna now have. Just a quick reflection. You know, the year I was born in Venezuela, and I'm Venezuelan for those who don't know, the country used to be one of the richest, most sophisticated countries, and now it's in a completely collapsed stage. And again, this is very sad to see how a country can get to this stage in such a short period of time, right? But again, okay, great. This is going to be a great panel, I think, and I hope all of you take advantage of our CSIS scholars in this panel. We're going to start with Errol. Errol, I know you were just in Colombia doing research on conflict and stabilization issues. I just want to ask you, how do you see this Venezuelan refugee crisis impacting the country? How does this compare to other crises that you have studied, that you have visited before? And talk us a little bit about the refugee status issue too, that I know is also part of that discussion. But thank you again.
Thanks, Moises. Thanks for your leadership on these important issues. I think the Future of Venezuela initiative here at CSIS is a leader of its kind, not just in Washington, not just in the United States, but globally. So I think you're doing a service to the country. I think you're really leading in a way that we're all proud to be your colleagues for the work that you're doing here. David, man, that was sobering. And I think one of the reasons that I'm on the stage is because I have looked into refugee and migration and just sort of human mobility issues around the world. And I don't need to reiterate what David just told you. This is bad, and this is bad on a truly global scale, and yet for whatever reason we can't seem to get the same level of response as we do to others. And I will say, to the credit of those who are trying to respond, my friends and colleagues that work in UNHCR and IOM and in ICRC and all the myriad NGOs and groups that are trying to respond, I mean, they're doing it with all of their hearts and they're doing it with all of their efforts. But there's only so much they can do without the resources that they need and the political cover that they need. So, Moises, I also think that you shouldn't take it personally that there was a precipitous drop in Venezuela once you were born. Correlation, not causation. So, I think one of the challenges with Venezuela is, for exactly what David said, this is not your sort of stereotypical war, violence, conflict situation. And when you think about the structures of international law that we have around forced displacement, you look at the sort of wake of World War II, and in 1951 there was the Geneva Convention, and that was strengthened in 1967, at which point the US and others signed on, and we started to see this thing called refugees, and we started to get some really robust international responses. It's worth pointing out that in 1984, countries across Latin America took the really bold step to even strengthen those international conventions, and through the Cartagena Declaration in 1984, they expanded the definition of what a refugee should be to include, and you're going to realize that a lot of these points that I'm about to say are related to the root causes that David just mentioned of why people are leaving Venezuela. So in 1984, at least 10, I think it was, Latin American countries came together and said, we're going to broaden the definition. This is not just, Jews being forced out of Western Europe. There's a much broader reason set of why people are being forced from home. Generalized violence, foreign aggression, internal conflicts, massive violations of human rights, and they even put in something called serious disruptions to the public order. Well, I'd argue that all of those things currently exist in Venezuela, and so in a perfect world, which of course we don't live in, everybody that is being forced from home in Venezuela would be considered a refugee. Of course, that's not the case. You heard David talk about refugees and migrants. There's all sorts of verbal dancing when people talk about Venezuela. I've heard the term people in refugee-like situations. Again, not for lack of wanting to actually call these people refugees. I don't speak on behalf of IOM and HCR and all the others, but I'm sure that they would love to provide the protections and the status and the support that comes along with having such an international status, but they can't because international law only goes so far. And international law is not going to trump national laws. And so while all of the countries that David mentioned, Colombia, Peru, Chile, Brazil, Ecuador, have been very generous in accepting lots of people, the fact that those people are not considered refugees means that they're susceptible to national level policy changes. And so what you see, I was just in Colombia last week, and one of the things that you're seeing is in places like Peru, they've recently changed their welcoming policies, for lack of a better term, towards Venezuelans, now requiring passports and visas. Sounds like a simple thing for those of us sitting in beautiful CSIS in Washington, D.C., but any Venezuelan knows that getting a valid passport, much less a visa in that valid passport, in the current situation is way, 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 way easier said than done. So much so that there's a flow now of Venezuelans who were displaced into Peru via Colombia that are now coming back from Peru up through Cali and into Bogota and even some back to Cucuta, which is essentially very close to where their walking journey, so vividly pointed out by David, began. So why, I think this status issue is important, so I'm going to linger on this for 30 seconds. Why are they not refugees? Well, as I said, international law only goes so far. In a lot of ways, you're beholden to national law, and I would argue that's probably the way that it should be. But also there's some, if someone has a refugee status, it sort of insinuates that they're going to be there for a little bit longer. And if you're a local politician in one of these countries that has been generally welcoming, the quickest way for you to lose your next local election is to say, bring in more Venezuelans. Let's be more welcoming to Venezuelans. Now, I don't agree with that, of course. However, local political realities the world over are not that dissimilar with regards to vulnerable people who are on the move. And so one can understand why there would be internal pressures not to actually acknowledge official refugee status for some of these people. I want to do a quick plug for the lack of funding that David mentioned. UNHCR and IOM are jointly leading in what I would say is a pretty novel collaboration between the UN Refugee Agency and the UN Migration Agency, and I think they're doing an admirable job co-leading the response to people in quote-unquote refugee-like situations. They've asked for about $1.6 million last June, and I think like a third of that has been funded. I'm not sure how countries like Colombia that are having their own challenges, that are going through their own period of perhaps rising instability are going to be able to deal with this. And so a slight appeal and retweet of what David was saying. On Colombia, very briefly, I think Colombia deserves a lot of credit for opening its doors despite pressures internally and externally to take a harder stance. From the Santos government to the Duque government had a lot of incentive to take a harder line stance towards Venezuelans, and I think everything that I've seen is that they have not taken that bait. Whether for historical reasons, David mentioned that Venezuelans had long received the displaced, and a lot of those displaced were from Colombia. Colombia was an arguably failed narco state in the 1990s, and now they're receiving millions and millions of Venezuelans, and so there's a historical bond there. But things in Venezuela and in Colombia, David mentioned the ELN. The ELN is strengthening, and they're operating at will. They are both protecting the Maduro regime in that their illegal mining and other sort of illegal activities are actually fueling the Maduro regime, literally. But they're also being protected by the Maduro regime. And that's important because they're also about half of their people are in Venezuela and about half of their people are in Colombia. And so the fact that they operate with impunity in Venezuela means that they can disrupt almost at will in Colombia as well. And so I think, and by the way, they're conscripting Venezuelan people in refugee-like situations into their ranks, and they're a very horizontal structure, which means that there's not one person, unlike the FARC, which is a very vertical organizational structure. The ELN is pretty diffuse, and so it's hard to control. So I think that Colombia is at an interesting point where they have a peace process, and they could either continue to go towards peace, or unless we resolve some of these fundamental challenges, including the strain on resources that are being caused by all these people in refugees-like situations, and I should clarify, not caused by the people in refugee, caused by the Maduro regime, which is forcing people to leave. Unless we resolve some of those things, and I totally agree with David, unless there is some sort of restoration of democracy and bring Venezuela back into its former place in the world, this is going to continue to be a challenge, and we're going to continue to need international support that, quite frankly, we're not getting right now.
Great. Thank you, Errol. That was great. You put up an issue that I'm going to make sure that we cover today, which is the lack of funding and why we haven't seen on Venezuela more funding, especially when compared to other countries, right? So I'm going to go back to that point. But before that, even if there is funding, we have access constraints, right? We can't get that funding into Venezuela. We can get it into Colombia, Brazil, neighboring countries, but not into the country. And there's still 25 million people in Venezuela who needs aid. About 7 million are officially in need of humanitarian assistance, according to the UN, if I'm not mistaken. So, and that number is only going to rise. So, in a way, we have an access constraint, and that's why we're bringing Jacob to the conversation. Jake, you have been studying how to best tackle access challenges in the humanitarian landscape around the globe. What can be done to ensure that the ability of aid reach Venezuelans in need, and what is the role of the U.S. and the international community on this process?
Thanks, Moises, and thank you very much for hosting this event and bringing attention to the dire humanitarian needs for Venezuelans in Venezuela and throughout the region. Thank you, as well, for David, for your comments. I want to just take a step back and speak to the point that you raised at the onset about thinking about this not as a country-specific or a regional problem, but as a global problem. Errol and David both highlighted the complexity of the root causes. The humanitarian architecture is very good at responding to a natural disaster, and even in situations in armed conflict, when you have the security and the political considerations at play that make humanitarian response complicated, that's something that organizations that deal in humanitarian contexts are to a sense, are very comfortable with. This is new, and so I think it's a global challenge, both because of the massive humanitarian need, but also because it presents both a challenge and an opportunity for the donors and the humanitarian agencies to figure out how to respond most effectively in a situation that they're not particularly comfortable with, and that's the total economic collapse of a previously wealthy and functioning state. So I think this is a global challenge, and I think it's a challenge for donors and for humanitarian organizations themselves. To the specific question, I want to start with a top-line point and then talk a little bit about the access challenges. From my perspective and my experience in the humanitarian community, the first and foremost step that needs to be taken when thinking about the humanitarian response is that the humanitarian assistance project needs to be depoliticized. Effective humanitarian action can be low profile and can still reach affected populations and support humanitarian actors working in the country. We saw last year that as international attention increased on this particular crisis, that the humanitarian response became hyper-politicized. It became the emphasis of people on all sides of the political dispute, and it put humanitarian agencies, both international and local, in a very difficult position. It created significant challenges for their operations. It also created safety and security risks. And from my perspective, every effort should be made, even while we have political conversations and we have difficult negotiations taking place, every step should be made to separate the humanitarian component from those political debates and negotiations. And we saw last year that after people pulled back from the brink, that the Red Cross and Red Crescent movement and the UN was able to negotiate space and negotiate access into Venezuela to begin the process of establishing the necessary humanitarian response. You talked about the funding challenges. We saw at the beginning of last year and into the middle of last year the establishment of a humanitarian response program and the establishment of the basic humanitarian coordination structures in country. When we think about funding, it is very clear that the funding that exists now is not sufficient to meet the massive need. But funding, the appeal and the fundings that go with it are based not just on the need, but they're also based on the capacity to respond. And so I think what you'll see in 2020 is the humanitarian community putting forward an appeal that's much more aligned towards the actual need, but is also based on a realistic assessment of what their capacities are to respond in country. You talked a bit about access challenges. So I think when we think about what's happening in Venezuela, we can think about a number of different access challenges. One is that there remains significant challenges for importation of basic supplies. This speaks to, I think, one of David's points on the lack of basic services and the economic collapse. There's the challenges for bringing in medicine and other commodities remain very, very difficult as a result of decisions and policies put in place by the authorities inside Venezuela. Customs takes a long time and adds to the costs for humanitarian actors. Movement within the country continues to be constrained. Basic infrastructure challenges, but also the lack of fuel and spare parts, again, causes an access challenge in terms of reaching the harder to reach areas where the humanitarian need is the same, but access is quite limited. Remote locations have humanitarian needs. The challenge of getting to those is a big cost factor for international organizations and the local organizations that respond. And then the insecurity. That presents a challenge for humanitarian organizations around the world. And even though compared to a Yemen or a Syria, the risk factors for humanitarian organizations are not quite the same. That security, that insecurity, that instability creates a very difficult challenge for organizations seeking to have a coherent and consistent response. And so, first and foremost, I think the steps need to be taken, and I think there's negotiation processes and diplomatic methods by which the pressure can be put on the authorities in Venezuela to alleviate those concerns. There are also steps that can be taken on the donor side and on the organization side. One of the things that's quite interesting in Venezuela is the adaptation by donors and organizations to new humanitarian practices. One thing that I would particularly point out is the use of cash-based programming. There is some cash-based assistance in Venezuela, which alleviates some of the logistical challenges that are associated with bringing in commodities for a humanitarian response. Given the economic contraction and the lack of the basic supplies, cash interventions provide an opportunity to assist people to meet their basic needs for a short period of time. And if done with the necessary flexibility and safeguards, can be a very good alternative humanitarian programming. It requires a certain amount of risk tolerance and flexibility on the part of donors. So I think that's a great opportunity for donors to really step up. Venezuela maintains several financial services which support cash transfers in US dollars to mitigate against the hyperinflation and some of the other issues that David spoke about. Jan Egeland of the Norwegian Refugee Council specifically spoke about how NGOs need to be allowed to use foreign currency to facilitate a more effective response. The last thing I'll say in terms of access challenges, I think, is a piece related to the sanctions. And I will not speak to the political decision to put in place sanctions or not to put in place sanctions, because that's not my interest. My interest is on the effect that sanctions can have, sometimes inadvertently, on humanitarian response. In this particular case, the United States has imposed a series of targeted sanctions on individuals, as well as sectoral sanctions on different parts of the Venezuelan economy. The administration has done very, very well and should be commended for creating very specific humanitarian exemptions provided through general licenses for both organizations to import certain essential commodities, but also licenses to allow them to work with certain elements of the financial system and elements of the Venezuelan government. Those licenses are essential, and again, I think the administration should be commended on making clear unequivocally that there's a humanitarian exemption and there's an understanding of the humanitarian need. That said, we've seen in Venezuela, as we have seen elsewhere around the world, when sanctions are implemented, there are second-order effects. One of the challenges is in navigating the financial system. So while large international organizations like the UN, the Red Cross movement, and maybe some of the larger NGOs are comfortable and capable of navigating some of those financial risk factors, many of the financial institutions themselves become skittish, and especially for the local organizations, the Venezuelan civil society organizations that have been at the forefront of this response, they're the ones who are reporting that they're feeling the impacts of the sanctions in terms of financial institutions' willingness to work with them to allow for them to meet the response. So all this to say is I think this is another place where continued effort on the part of the folks in the administration who are responsible for implementing those kinds of programs to work with not just the partners that they're comfortable with, but also finding a way to work with the civil society organizations that are at the front line and might be feeling this a little bit more acutely would be a really important step to take to alleviate the humanitarian concerns. Thank you.
Thank you. Thank you, Jake. Okay, that was great. Catherine, one of the challenges we have in Venezuela, again, thinking globally and from a global perspective, that this is bringing up different crises, social, economic, political, institutional, but especially there is a health crisis going on too, and this is affecting not only Venezuela, the region, and even more broadly, right? And as you know, Venezuela was the first country to eradicate malaria. Now we're seeing unprecedented cases of malaria emerging in Venezuela. I know you have studied different global health challenges, and you are in the best, one of the best ranked global health policy centers in the US. What's your perspective on how should we respond to the health emergency in Venezuela, and what should the US and the international community do about this?
Well, thank you, Moises. I thought that I would provide, building on your recollection of the eradication of malaria, to look a little bit into the past, say what we know about the present and some ideas about the future. So if you look back 100 years ago, the situation in Venezuela the health situation was not great. Life expectancy was only 42 years. There was a very high maternal mortality rate, and it was a predominantly rural population. But by the 1950s, we'd seen significant changes, the growth of the health sector, An influx of refugees from the Spanish Civil War and Europeans after World War II brought healthcare providers, doctors, nurses, and others who really staffed up what was increasingly an urban setting for healthcare in that time. Venezuela was the first country in Latin America to eliminate smallpox in 1956. 5 years later, the World Health Organization recognized Venezuela as having eliminated malaria in the most populous areas. The 1961 Constitution recognized the right to health. And the health system, as I think David was explaining, was really a magnet for people from other countries around the region and even the world to come for basic services, for surgery, and the like. By the 1980s, Venezuela had a mixed system of public and private health providers, and it was beginning to show signs of strain. There was a decentralization process and accompanying growing inequities in access to health care in rural and urban areas. And this led to tensions, including the incorporation of health concerns in the Caracazo in 1989, the discontent around a broad range of social issues. The cholera outbreak in the 1990s further highlighted inequities, particularly in access to healthcare among the urban population. By the early 2000s, a new constitution reinserted the right to health and reprioritized that, along with a new focus on a strictly public health system that would promote the delivery of timely and high-quality care. What happened in the years after that was not so much a replacement of the health system, but a layering of a new system of public health approaches on top of existing older practices that led both to tensions and inequities in these multiple systems, challenges around licensure of medical professionals and even portability between the systems themselves. The economic crisis more recently has further exacerbated those issues. The departure of healthcare providers in the vast migrant streams, both around the Americas and Europe as well. Also, the growth of informal activities, including gold mining in the south of the country, where there has been a huge resurgence of malaria, which is, as Moises said, is really a tragic outcome, when you look back 70 years to that early recognition. One of the key problems now is the dearth of recent comparable data on the health system in Venezuela. The Pan American Health Organization, which is the regional arm of the World Health Organization, shows data on issues like maternal mortality and infant mortality only through 2013 or 2015. So there hasn't been consistent reporting that would allow us to look at the situation in Venezuela and compare that data with what other countries have provided over a more recent period. From the period from 1990 to 2015, you can see that there were consistent improvements in many areas. But around 2008, you start to see an uptick in malaria cases, and tuberculosis data stops in 2013, but had showed a leveling off up to that period. The WHO provides some estimates of immunization coverage from the period since 2015, and you can see that between 2016 and 2018, there are significantly lower rates of some of the key indicators for immunization system health, like the diphtheria, tetanus, pertussis vaccine, and there's no reporting on access to the rotavirus vaccine or the pneumococcal vaccine, and I think even for yellow fever, the rates really drop off. WHO and UNICEF maintain a joint monitoring program on access to water and sanitation. That data goes through 2017, but there's very little data, for example, about health facilities and some of the more recent assessments about WASH in hospitals and other care areas. And then even the World Bank assessments of annual GNI per capita, that information stops at 2014, and as I'll say in a minute, that's often a criteria for eligibility for access to things like Global Fund support and support from Gavi, the Vaccine Alliance for Immunization work. So a second problem, aside from the dearth of comparable data from official sources that we could really look at to compare the situation over time, I think is the potential for the growth of drug resistance around some of the key indicators. According to UNAIDS estimates, 2/3 of the people living with HIV in Venezuela, which I think for their most recent data, they set at about 120,000 estimated people, only 1/3 are on treatment or have access to antiretroviral therapy. We know from the civil society reports, journalism, and other assessments that even those people who are on ART are not able to access the drugs all the time, as Jake was discussing, the challenge of accessing medicines, or in many cases, they're not able to get the exact ones that they need or that they've been prescribed. So over time, there's a potential for the transmission of virus that is drug resistant. Malaria. Certainly there's been a huge resurgence in cases of malaria, much of it fueled by the harsh conditions in the informal gold mines in Bolivar State and the activities in that area. What we understand from research and discussion with people in that region and across the border in Brazil is that when people get fevers, they don't necessarily know they have malaria. They think they might have malaria. They cross the border to Roraima in Brazil. They might buy some drugs. They might bring them. They might take them. They might take some of them. They might take them back and sell them. And so, in a very ad hoc way, people are taking drugs. Maybe they have malaria. Maybe they don't. Maybe they're taking it incorrectly, and so increasing the chances of drug resistance. At the same time, tuberculosis, the rate of tuberculosis has not improved, at least according to the available data. There's very little in the way of diagnostic materials or treatment. And so, again, there may be cases of multi-drug resistant tuberculosis where these are not being adequately diagnosed or detected. They're being improperly treated. And again, it increases the odds of the transmission of drug-resistant strains over time. For the multilateral response, I think there are a few things that we can look at. PAHO, the Pan American Health Organization, has a country office in Venezuela, has maintained a regular dialogue with the government around a number of different issues, and provides technical advice and assistance where it can. UNICEF has been able to do some assessments, on-the-ground assessments around water and sanitation, around the conditions in health facilities, among other issues. And so, was able to make some of that assessment and technical advice as well. Now, the Global Fund to fight AIDS, malaria, and tuberculosis does not consider Venezuela eligible for assistance. Its annual GNI per capita is too high, so it's out of that eligibility threshold. However, in 2018, the board recognized the emergency circumstance in Venezuela and allocated, I think, up to $5 million to support the purchase of critical healthcare products. And in 2019, approved another $6 million for drugs for HIV, TB, and malaria. And this is interesting, and it speaks to some of the flexibilities that Jake was talking about, the Global Fund and other organizations like Gavi, which I can address in a minute, really also rely very much on, being able to work closely with governments to undertake financial audits, to ensure that the funds that are being allocated are properly accounted for and spent. And the Global Fund board, in recognizing the emergency situation, also recognized that it would need to allow for greater flexibilities and new ways of thinking in order to make this happen. The board also approved eligibility for Venezuela to seek support for malaria in the 2020-2022 period. And then I would just say, Gavi, the Vaccine Alliance, also does not consider Venezuela eligible, and even under its recent emergency, fragility emergency and refugees policy, does not consider Venezuela a potential candidate for application at this time. So just in terms of looking ahead to future issues, I've talked about the problem of the potential for greater drug resistance around malaria, tuberculosis, and HIV. The dearth of water and sanitation in health facilities is certainly a challenge for infection control and the prevention for the spread of infections from those facilities. The issues of immunization coverage are concerning. We've seen the resurgence of measles in the region. I think most of the cases currently, that have been reported have been over the last year, about 88% have been in Brazil, but there's certainly been a number of cases reported in Venezuela, and there's a potential for that to continue to spread without adequate sort of addressing each new birth cohort that comes along. And then finally, I would just end on thinking about global health security. The recent Global Health Security Index released by the Nuclear Threat Initiative and Johns Hopkins University ranked Venezuela 176 out of 195 countries on issues like disease prevention, detection and reporting, the health system response, and the overall ability of the health system to address health emergencies and respond to international norms. Some areas were fairly positive, like cross-border agreements on emergency response, but others, including the ability of laboratory systems and surveillance mechanisms to really track diseases, were quite low. Just yesterday, the World Health Organization declared a public health emergency of international concern over the novel coronavirus circulating in China and elsewhere, and I've not seen that there have been reported or confirmed cases in the South America region. But if it does become widespread and get to Venezuela, I think the situation around access to healthcare and the ability of the system to really respond adequately to an outbreak like that would be cause for concern. So.
Thank you, Catherine. Indeed, that's the last thing that Venezuela needs, right? Another virus that spread quickly in such a collapsed health system. Okay, so I want to be mindful. We have about 28 minutes left. I want to make sure that we have time for Q&A from you guys, so thank you for being patient. I want to bring David to the conversation briefly, and I also want to throw a question for the three experts and on the next few minutes, right? David, one of the things that I like about your presentation is that you always think on the potential future scenarios, right? If the status quo continue, we will have over 6.5 million refugees by the end of 2020. If the status quo continue, we will have X levels of diseases and hunger. And I want you to tell us a little bit in 2-3 minutes, if you can, how do you see if the status quo continue impacting the stability of the region more broadly, right? And this is an important question because the status quo, like it or not, is probably the most likely scenario today. I don't see a way out in Venezuela, and then so we need to think kind of on the future. Well, what are the contingencies plans that we need to take in place? Before you answer, David, I'm going to throw the question for our panelists just to get them thinking. You heard from Smolansky's presentation that the levels of displacement, disease, and hungers of Venezuela compared to those of South Sudan, Myanmar, and other countries is yet to be a top priority for the international community. Why do you think this is happening? I mean, you're studying other crises, you've seen other responses in other part of the world. Why do you think Venezuela is not deserving the attention, is not getting the attention that it deserves? And what can the Venezuelan people, the interim government and the Venezuelan allies can do better to change this mindset of the international community to stop looking at Venezuela as a local issue, but more as a global issue that needs more funding, more attention, and more priority? David, back to you.
Thanks, Moises, and it was also very good to hear from experts on this crisis, and I appreciate all your thoughts and proposals on the Venezuelan migration and refugee crisis. I think the region already is over its capacity, and no one saw 5 million people fleeing Venezuela. There were some projections, some estimations, but so there's no enough budget. We have already talked about it. There's lack of infrastructure. There is lack of services. So if the status quo continues, Moises, which I could interpret that the dictatorship continues in Venezuela and the fleeing of people continue, we could see more xenophobia against Venezuelans. We could see more people being vulnerable to be recruited to illegal groups and illegal activities. We're going to see, unfortunately, more people dying trying to get in boat to Curaçao, Aruba, Trinidad and Tobago, or people dying in rivers trying to get to Colombia. We're going to see more people sleeping on the streets, or we're going to see people in shelter for, there are shelters for 5 people, and we're going to see 20 people sleeping on those shelters. So this has to stop. And for me, it has been a learning process on this, and I want to be very humble on this. I mean, when I started here, I was not a migration and refugee expert. My experience was to see my grandparents fleeing the Soviet Union. My father fled Cuba, and I had to flee Venezuela. That's a very hard experience, but it was a familiar one. So I have learned a lot from the experts that have a humanitarian approach. But I think the key here is how we combine the humanitarian approach with the political approach. This crisis cannot have only a humanitarian approach and cannot only have a political approach. It has to be a combination because, as Arul said, this is new. I mean, as you say, sorry, this is new. This is, I mean, the architecture of humanitarian organizations are prepared when there's a natural catastrophe. We see Dorian hurricane, so you have the humanitarian organization. Armed conflicts, you see humanitarian. But you are having a territory, a country, a nation that at the same time is having hyperinflation, high increased violence, human rights violations, irregular groups acting, illegal activities happening, humanitarian crisis. All of that is happening at the same time in a country of 30 million people. So we have to combine that to guarantee protections for the ones who have fled, but at the same time, the political solution that we need is to stop people fleeing. And the only one I see, the only one, is to restore democracy and freedom in Venezuela. And to restore democracy and freedom in Venezuela, and I'm going to say this as a personal opinion, is getting rid of the dictatorship. There's no other way. I mean, the longer Maduro stays, the more people are going to flee. The shorter Maduro stays, the less people are going to flee. So that is why I said at the end of my presentation, the challenges not only are for the policies to implement, to protect the ones that have fled, like implement Cartagena Declaration, the documentations, and the healthcare, but also how we solve as soon as possible the crisis in Venezuela, which, by the way, that was important. In my visits to the region, more than 1,500 testimonies that we have already done, I have not seen, and this is literally, the first Venezuelan saying that fled Venezuela because of the sanctions. I have not seen that, at least on the work that we have done. So that's a myth that the regime and some organizations are trying to create. People start fleeing way before the sanctions.
Thank you, David. Okay, I'm going to give you guys about 2 minutes each, if that's okay, maybe 3. I just want to make sure that we have time for at least a round of questions from the audience. But again, how can we help Venezuelans and their allies to change the mindset of the global community, that this is a priority, it should be a global priority, and provide more support?
You looking at me?
Yes. I'm looking at Catherine.
I think we were all looking at Catherine. I'll say 2 quick things, but the reality is I don't know. I mean, what David presented at the beginning is stark. And if we lived in a world where people made policy decisions based on data, you'd probably have one of the highest responses in the world going to Venezuela. Apparently we don't, so there isn't. 2 things I will say is, I think, and we've talked about this before, Moises, but the Venezuelan diaspora is huge. This is a middle, sort of higher middle income country before the political crisis there, and there's, I don't know how many Venezuelans outside that are not forced out by this sort of the crisis that we've been talked about, but have left at the beginning of it on planes, not walking out because they had resources, folks that came for jobs, folks in the oil sector. There's lots of incredibly, incredibly talented, smart, and dare I say wealthy Venezuelans out there. I think more organization by the diaspora to get this on policymakers' agendas, both here and in Europe, is important. The last thing I'll say is there is donor fatigue. I look at forced displacement scenarios the world over, and if we were having a conversation on Syria, there would be a similar level of whinging about lack of donor support to Syria. And so I think that there is donor fatigue. Conflicts and crises are lasting longer. People are staying in displacement for longer. And I think that makes it really hard for donors. It's not giving them an out. And by the way, it's not just individual donors, it's kind of collective donors. I think the U.S. has been one of the largest, if not the largest, donor to the response in Colombia, but it's not just about the money, it's about leadership within the international system and bringing others along, and I think there's certainly room to do more of that.
Maybe I'll just pick up on that piece of Errol's. When it comes to funding, one of the interesting things is there's the perception, as Errol's highlighting, of a lack of funding, but if you look, while the overall appeals have skyrocketed in the last few years, the billions of dollars that are needed for all the humanitarian emergencies around the world. And the gap is bigger than it's ever been, but there's also more humanitarian funding than there's ever been. And so this is one of those where I'm somewhat sympathetic to donors because they are continuing to increase the overall funding, and yet it does not meet the scale or scope of the need. So I think you do have, and I will, again, co-sign with Errol, I don't know why this fails to generate more funding or more attention. From a certain sense, I don't think that there's a lack of attention. I think it's the complexity of the challenge, and it doesn't have that triggering event that draws the international attention, or and it's hard to say, but it also doesn't have the conflict dynamics that create a compelling narrative. One of the reasons, there's an auxiliary reason why funding for some contexts is higher than others, which is that international humanitarian law compels parties to a conflict to support their humanitarian outcomes of a situation of armed conflict. So there might be contexts which have a greater level of humanitarian funding, but that also relates to donor presence as parties to a conflict. One thing that I would say, though, to the question of how to generate more attention or more awareness is there are now, in the last few years, various different intergovernmental technical political processes underway to both think through some of the political questions, but also think through the response regionally and inside Venezuela, but also in the countries that are hosting the large amounts of migrants. And one thing that I think would be essential, and a lot of the civil society organizations have made this point, is that those organizations, Venezuelan and from elsewhere in the continent, be allowed to participate in those technical processes, be given a voice at the table when governments and the UN and international organizations are speaking to the response, to find a way to ensure that the civil society organizations, particularly in Venezuela but elsewhere in the continent, are at the front lines of the response, are given a voice and are given the opportunity to speak to both the challenges that they're addressing and also given an opportunity to reflect on the best way that the international community can respond, because they'll have insights that people sitting in Geneva and elsewhere may not have.
Thanks, Jake.
Yeah, I would just add on the issue of civil society is that we've seen considerable challenges in terms of working with civil society inside of Venezuela, just the ability to really access and work in a consistent kind of way. I would say some of the international organizations or the multilateral groups have, as I mentioned, increased their flexibilities, around both working directly with civil society and, the accounting flexibilities. I think, we need to see more of that, and, maybe things not strictly tied to the GNI per capita, but, that there be other kinds of eligibility issues as well. Just, thinking about, your larger question of, why hasn't the issue gotten so much global attention? I think to some extent there is still, a memory of Venezuela as a, upper middle income country with very high, capacity, and in a region of middle income countries that, just aren't generally eligible for assistance in the way some other regions are. And then finally, this idea occurred to me, just this kind of complacency that, there's this long-standing tradition of Pan-American solidarity. The other countries in the region have been, have received so many, migrants, over the past number of years. And, I just wonder if some of the other regions that haven't had that same kind of history of interregional engagement, just are kind of say, oh, well, they'll just take care of their neighbors themselves. Mm-hmm. I don't know. That's a question.
Alrighty, thank you. Okay, you all been very patient, thank you. I'm just gonna ask you to say your name and your affiliation. If you have any questions, just raise your hand, please. We have mics on the back. So we have two people here. Let's just give them one mic each. Yeah, go ahead. Okay. You can.
All right. Hello, everyone. My name is Kayla Parson. I am a student at James Madison University. First of all, I do want to say thank you to the panelists. I think we can all say that we appreciate your insight on this topic. So my question, it was previously stated that the number of individuals who are being forced to flee Venezuela is very similar to the number of Syrian refugees. Along with that, there is a hesitation to actually use the term refugees to identify these individuals. It was also stated that international law is not going to trump national law. With these in mind, what has to happen from the international community to overrule national law and to recognize Venezuelan individuals being displaced as refugees? And as a follow-up question to this, what do you feel is the possibility of these potential solutions actually being implemented in a proper manner?
Thank you. Thanks for the question. Let's go to the second question right in front of her.
Thank you so much, and hello, everybody. My name is Elizabeth Williams from the Department of State, and so my question is regarding this topic of why is Venezuela the most underfunded crisis in history. My question for the panel is, are the humanitarian restrictions and constraints that exist in Venezuela right now with the access, the manipulation by the regime, that kind of thing, is that worse than any other crisis as it has been? Because that could be a factor. If you're a donor, you want to see your dollars go to good use. You want to see your money reaching the people in need. And so just like if we're donating to charities, we want to make sure that our money is going there. So if there's these restrictions in place, perhaps that could be dissuading donors. Thank you.
Thank you. Excellent questions. Okay, let's go to those two, and then we're going to have time for one more. Okay, so we have about 3 questions. One is on the term of refugees and why this matters and is important. I know, Errol, you have thoughts on this, and David, you have been looking at this issue closely. And then we have the access constraints connected to the lack of funding, potentially. Jake, you probably can tackle on that. And Catherine, you should feel free to jump in too. But let's start with you, Errol, and David.
Por favor.
You are having you're good on that topic too. Well, I think there is you need political will, basically. That's the most important thing from the governments to at least give the option to Venezuelans to choose to get the refugee status. As I said, we visited Brazil only 8 weeks ago. They're doing that. Mexico as well. And other countries, they have created some special permission, like Colombia, they have their, in Spanish I'm going to say, permiso especial de permanencia, which is a permanent special permission, or Peru, they have their permiso temporal de permanencia. So some instruments have been created, but we need a regional consensus on this. And if Venezuelans are recognized as refugees, they will have a permanent protection. They should be guaranteed to access to healthcare, education, apply for a job, open a bank account, have a documentation. And the Cartagena Declaration cannot be clearer. I mean, all of the Cartagena Declaration that explains why a person should be considered a refugee is going on right now in Venezuela. Everything. So I think we need more political will on this, and hopefully maybe we can see that on the next months. I cannot guarantee that, but from the OAS as a multilateral with more than 30 member states, that's the policies that we're trying to promote.
Building on that, I agree with everything there. I think I want to highlight one thing that Jake said previously. In political processes like the Lima Group, this is precisely why civil society should be engaged in those more sort of seen as political things. Because if you have civil society and NGOs and those that are on the front lines of responding to this humanitarian crisis, they tell you that the differences in response from policy perspectives, some require visas, some require passports, others have temporary cards, and you name it. And oh, by the way, they change every 6 months, and there's 10-ish countries that all have different things. I mean, I'm getting a headache just thinking about it. And imagine if I'm a Venezuelan who has walked thousands and thousands of kilometers only to find that the policy has changed right when I arrive at the border. And so, even if full-on refugee status is not granted, one of the things that the Lima Group and other sort of political processes could do by incorporating civil society voices is at least try to get on the same page. Try to standardize. Everybody's got their own domestic political constituencies, but you can at least try to get on the same page. And I will say the question was excellent. But it was framed as, what can the international community or international law do to overrule national law? And that rarely, if ever, happens. And so I think their international law is really, really critical because it provides a framework for nations to build their own frameworks of response. But unless there's domestic political will in these countries that are receiving Venezuelans, there's sort of no way that there's no sort of magic international law wand that can force a country to, only in very, 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 very rare circumstances is that the case, and it's certainly not here.
Yeah, just building on that point, I think the value of the various processes that are underway are allowing donors and other affected states to come together to impress upon those countries that have already done a very good job of hosting those migrant populations to continue to provide them the safety, the security, the status that they need to live in dignity. To the question about access and funding, I mean, if you look at David's presentation, the countries that were up there, no, the access challenges in Venezuela are not any more severe than the access challenges in Syria, than the access challenges in Myanmar. Myanmar is a closed state. The Rakhine state was essentially shut down for international and national, local NGOs during the period in 2017 when the Rohingya, were expelled from that country. So, I mean, even Afghanistan, right? The different kinds of access challenges that might be manifesting in Venezuela that manifest acutely in those three countries, if not everywhere else. What is important is that donors, the United States and the Europeans and others who contribute to humanitarian action have found ways to work with the humanitarian organizations to allow them the space to mitigate the access challenges in a way that both meets the needs for donor accountability, but also allows them the best opportunity to reach those affected populations. In this particular case, and I think we have to, even though it's one big challenge, we have to bifurcate the humanitarian response in the countries in the region and the humanitarian response plan for Venezuela. If you look at the humanitarian response plan, it acknowledges that there's some 7+ million peoples in need, and that the humanitarian response plan as exists will only reach a fraction of those people, but that's based on the fact that the UN was scaling up in country for the first part of 2019. The structures that are needed to ensure the accountability to donors, the cluster system, the staff, the basic infrastructure for a large humanitarian response was only established in the middle of 2019. So I think you will see in 2020 a larger appeal, and an appeal that is both based on evidence of need, but also based on a firm understanding of the capacity of the organizations, local and international, to respond. And then again, the question will come back then to the donors of how much of this are we able and willing to respond to given the severity of the need.
Thank you, Annie. Yep.
Yeah, I was just thinking about this question of, is access, easier or harder than in other places? And it made me think of the current situation in Democratic Republic of Congo with, trying to fight the Ebola outbreak. And, there's a situation where it's costing $1 million a day, at least. The international community, has been very focused on addressing that, even though in the eastern part of the country, there are armed groups, have been, attacks on healthcare workers, and it's a very insecure place, to be operating. And so there's been a commitment, nevertheless, to support that and to move forward. And so whether that's because there's fear of the spread of, a scary and dangerous disease, to other places, and so that's what's galvanizing people, or, I don't know, but it's certainly perhaps something to consider.
Yeah, I will just add, yeah, go ahead.
I was just going to say, as I'm sure there will be other questions, but Jake mentioned something that I want to just build off of real quick. So Jake mentioned that the appeal was based on over 7 million people, and you might be thinking, wait, I thought you said that there were 4 to 5 million Venezuelans. It's a really, really critical point that appeals are also meant to support host communities. This seems like a very sophisticated audience, and so I'm sorry if that comes across as overly pedantic, but it's a really, really critical point that the response is not just about Venezuelans. The response is for those communities in Eastern Colombia that themselves have dealt with decades of conflict and where the state is not always present, and they're sort of suffering their own more development, even sometimes humanitarian challenges. And so it's a really critical point to make sure that we don't forget about those host communities.
Yeah, no, that's a key point, especially when you look at Europe, right? And you see refugees coming into Europe. European countries have a better infrastructure and better ways to deal with the influx. But Latin American countries, unfortunately, they're dealing with poverty and lack of capacity and so many issues. But that's a key point. Okay, we have about 3 more minutes. Let's go one more question. There's one question here.
Luca Dall'Olio from the International Organization for Migration, IOM. Thank you for your remarks on the unique modality of coordinating the response among UN agencies, the joint platform, UNHCR, and the special role of the special representative advocating with governments in the region for continuous open door policy towards Venezuelans is very important, and the Quito process politically is very relevant. But moving on to the humanitarian aspect and the funding issues, well, in December there was this solidarity conference in Brussels. So let's hope that the pledging conference that is being announced, although not yet convened, possibly in Washington in conjunction with the spring meeting of the World Bank, will provide a robust response. But among the reasons that make us wonder why the Venezuela level of assistance is below expectations, shouldn't we also factor the politicization of aid in the Venezuelan context? Principle of impartiality, neutrality, independence should be our driving modality, and in the Venezuelan context, both within the Venezuelans and outside, aid, and humanitarian aid in particular, seems to be exceedingly politicized. Is this a deterrent in your views or not? Thank you.
Great question. Thank you. Okay, let's go to that question directly. I think it's a good one. Jake,
Yeah, I would say no. Only because, unfortunately, you've also seen humanitarian aid severely politicized in contexts like Yemen and Syria as well, where you have, I don't remember the figure on the board before, I think it was $33 billion of international assistance being provided to Syria. I think there may have been a moment when that was a cause for pause by some humanitarian donors, but I don't think that's a reason why the funding has been low, although I think that I would reemphasize the point that the politicization makes it more challenging for the aid organizations to deliver the assistance, particularly inside Venezuela, for various different reasons that I enumerated before.
And a supporting point on that is that a lot of the funding is not for Venezuela. Some of it is meant to be inside of Venezuela, but there are politics across the region, but a lot of this is meant to support places outside. I would echo, I think, this sort of, it's not a unique situation, though, that aid gets politicized, unfortunately.
Alrighty, I think this has been a fascinating discussion. We all have a lot of homework to do in terms of how to change this narrative and help Venezuelans further. But please join me to thank the panel. I think you all deserve a big thank you.